Hello, my name is Annalie Martin, and today I will be speaking with you about removing an indwelling urinary catheter and also the 24-hour urine specimen. I did forget this one when I was talking about the other ways to collect a urine specimen, so I just wanted to talk about this one with you. So this test is it's a simple lab test where it measures exactly what is in your urine. This test is also used to test your kidney function. You will want to make sure that you instruct the patient to clean the area before they go to the bathroom, and you will also want to put that in the refrigerator as needed if that is what the hospital's policy is. Sometimes and then you will also want to make sure that you label that appropriately and make sure that you assess the urine as well, just like in the other forms of collection. So the big difference here is that you will be collecting the urine over a 24-hour period. So now I will get started on removing a indwelling urinary catheter. So in this case, you will definitely want to be using clean technique. And to prevent trauma, you will want to deflate the balloon completely before removal. And when you first get started, you're going to want to make sure to prepare the patient because they may have difficulty urinating, swelling after the removal, or they may also have some burning when they go to the bathroom because they had this in so long. But what it does seem is that a lot of people are happy to have this removed even with the pain, because it can be quite uncomfortable to have one of them as well. So a lot of the time the patients, like the one in the video, seemed very relieved to have this removed. So you are going to want to have the bed at a working height, and then you will want to make sure that you have your gloves on, and then you will drape a blanket over the bed, and you will only want to expose what is necessary. I don't have a second blanket here, so in this case I kind of have to be able to show you what I'm doing. But the patient, you'll want them to instruct them to bend their legs and open out their legs a little bit. It's a little hard to show with Yoshi's little legs, but I'm trying my best. So after that, you will want to there will be a strap to keep it in place on the leg. So you will want to untie that strap. You will want to insert the syringe into the balloon, and well, first you will want to also sterilize the inflation port, and you will want to make sure to let that dry. So then you will insert that syringe, and you will just let it naturally fill with water. You won't want to you don't have to like pull it or anything. It will just come out by gravity. So you're going to empty that. In the video they emptied it right on the pad, and then you'll put it back until you're going to keep going until all of the water is removed. Now the next part, you will want to ask the patient to take several deep breaths just to keep them calm and kind of distract them from the pain that they may feel when you remove it. So after you ask the patient, could you please take several deep breaths, you will slowly pull out the urinary catheter. So the next thing you are going to want to do is make sure that you clean the area, just like we learned when we were providing the bath for the patient. You're going to want to clean that area very thoroughly, because that area and the urinary catheters, it's very common for patients to develop hospital-acquired infections. So you will want to clean that area properly. You will get rid of your gloves, and then you will want to make the patient as comfortable as possible. And you are going to want to just check on them and see if they're okay. You're going to want to measure the urine from the catheter. You're going to want to document the type and the site. And you're going to want to also document the patient's reaction. That is very important as well. You are going to want to record the amount of urine and also the intake and output. So that is all today. Thank you.